Hi everyone, I'm Dr. Alka Bulchandani. I'm an oral medicine and radiology specialist. Today I'm going to show you the software which I use for viewing the CBCT scans. I'm using this Vatech software and keys. So by this software, you'll get a basic knowledge of almost all the softwares, how to run them, how to view the CBCT scans. Okay, I'll minimize my screen. And I've opened this X-ray. This is when you open an X-ray, we'll show you how do we open. This is the software logo, EZ3DI. It is a Vatech software. We click it and then we go to the main menu, open, and then in the downloads, I just selected this patient. I've extracted the file from WeTransfer, and then I've opened it directly on the software. This is the MPR section, the first section. Second is sections, multiple sections are visible on this. The third is 3D pan, where a 3D constructed image is visible. And then TMJ, and that we can go later, but this is just for the basics. MPR is multiple planar projections. This is the 3D reconstructed one, axial, coronal, and sagittal. As you can see, in the 3D, we have this 3D reconstructed by this VR coloring option on the left side. We can make it this way also appear. This is soft tissue projection, but yes, CBCT is very bad in soft tissue projection. This is the best view we can give for patients to understand. Then this is the axial view. This is the red. The red thing is for the sagittal. As you can see, I'm moving this red longitudinal line on the axial section, and then the sagittal view is moving from right to left. The yellow is for the transverse coronal sections. So as I'm moving this, the coronal sections are moving. And then the blue one here is for the axial, the blue line. So if you want to see the axial sections, you can move the blue line. But what I do is I'm using a mouse. So I'll just scroll up and down. I'll just take my cursor on the axial view and then scroll up and down to see if you don't want to move the lines. Again, if you want to see the coronal, take your mouse there and scroll up and down. Again, the sagittal, take your mouse, scroll up and down. You can see all the sections. You can even see the bite block here. The patient has not bite on the notch. We can see the positioning. Here also you can see the patient is not centered. There is a positioning error. Usually this plus sign should be here in between the central incisors. And yes, you can see, you get an idea of the FOV also from this view, this 3D view. You can see the FOV is good, not that great also, and not that bad also. We can see the entire maxillary and mandibular jaw, but we are not able to see the airways and the entire coronoid process, condylar process as well. And the maxillary sinus, we are not able to see completely because of the limited FOV. But this is fair enough size for a dental day-to-day use. Now, then after MPR, we have sections. This is the sections. We draw a curve and then we get multiple sections of that curve. So we can select a region by drawing a curve. The one is by default. This is already set by the computer. The second one is I have drawn on the right side of maxilla, starting from maxillary tuberosity till the midline. Third one, if you want to draw, I'll show you an example. Draw curve, starting from here. Make sure you draw the curve in the center so that you get good sections. You don't miss out anything, palatal or buccal bone. Accordingly, you do curves. This is the thickness. Thickness, usually I keep it 0 mm just for the clarity. If we increase the thickness, suppose 1 mm, you can see the image becomes a little diffuse. And then more thickness, more diffuse. So better to keep it 0 mm. Interval you can change. If you want 1 mm is the ideal one, usually for single implants, 2 mm for full mouth implants, because it's very difficult to mark each and every point, and it is useless also to do it 1 mm. To 1 mm we can do for pterygoid implants, or where in places where there is very minimal bone and you want to see exactly, you don't want to miss out limited bone. So that time we do 1 mm. You can do 0.5 mm as well in cases of root canals, maybe very anterior root canals, if you don't want to miss even a little bit of anything. If you see, if I'm doing 0.5 mm, you see the number of slices, they are increasing to 251, which is a very big number to evaluate. So just when there is one single tooth, we can do this 0.5 mm just to see the root canal. 1 mm, you can see the number of slices are around 125. Then 2 mm, you see they became 64, 63, 64. So this is the usual intervals which we keep by drawing a curve. You can draw a single tooth curve like this root canal treated tooth. You can see this curve, since it is 2 mm, just 8 slices are appearing. We'll make it 1 mm. And you can see 16 slices of the single tooth. If you'll make it 0.5, it will double, 32 slices. Then now next is panorama. This is the panoramic image. This is the focus. We can remove the focus by pressing the space button. But yes, diagnosis based on the panorama should not be done because it's reconstruct. As you can see, the information 3D panorama has been reconstructed from CT image. So please use it with caution in making a diagnosis. We can change it again, just like that 3D thing. This view looks good for people who are used to looking at X-rays. So for doctors, I send this. For patients, this one. But still, in concluding a diagnosis, they are not helpful. For concluding a diagnosis, you always have to see the slices, to see the PDL, to see the continuity of the PDL ligament, bone loss. This is the panoramic. Now, yes, this option is panorama, which is created here by our curve, which we have created in the scout image. This is the scout image. This is the panorama constructed by this curve. So suppose this longer curve, curve number 3, which I did previously, So for this scout image, they have created a bigger panorama. Now, this panorama is set by default 10 mm thickness and 1 mm interval. If you want to see the entire thing, you can increase the thickness 20 mm, but then it reduces the quality. See, in increasing the thickness, you can see everything in one go, but there is a lot of overlapping. 10 mm is ideal for this. If we reduce the thickness, we can see much clearer. But as you can see, the maxillary incisors edges, they are not visible here because what is happening, I have reduced the thickness to 3 mm and then this curve is right at the center of the buccal and palatal plate. And the incisal edges, they tend to procline forward a little bit. So that's why they are cut in this section. So for optimal viewing, we increase it to 10 mm. We kind of keep it in the middle. This is for inserting implant. And this one is windowing. This is also adjusted. If you want to change the contrast, you can change it for confirming your diagnosis or seeing a particular tooth. But usually it is again adjusted by the software to its optimal value. And I always increase the sharpness, but by removing the sharpness, also you can see the trabecular pattern, but usually it looks more appealing to the eyes by this feature, maximum sharpness. This is smoothness. It doesn't make any difference. It reduces the quality of the image. Sharpness is okay. It is still increasing, but maximum sharpness is the best. Inverse also you can do if you are used to see the inverse images. Maximum intensity projection. This is used for implants sometimes and crowns but again, this will help in viewing the most radio opaque object, but then again it will reduce the diagnostic ability because only the maximum radio opacity objects are visible. The minor light radio opacities like the trabecular pattern, they are not visible in this. This is VR. Again, it looks like a 3D image, which we don't use on a regular basis. Maximum sharpness is what I use. This is a change layout option. You can change the layout to anything preferable like this. Okay. So the layout has been changed. Whatever your eyes are used to, you can keep that as a layout. And then there is this open report thing when you want to give report to the patients. It is not inbuilt in the softwares usually, but if your center or your clinic or hospital are sending reports regularly to the patient, hard copy reports, then this feature has been added to the software. Like you can see, I'm opening the report and I get all of these options. So here my panorama and the multiple section images will be appearing. We can change these layouts also based on what we want to give to the doctor or to the patient. I'll share more as per the cases in the next videos.